Hello, boys and girls, and Mrs. Pfeiffer. My name is Mrs. Kalinowski. I am Hogan's mom. I'm here today to talk to you about the field of nursing and how you can become a nurse. Nursing has a lot of science involved. So since I was probably in second grade and all through school, I always loved every science class. I was always curious and wanted to know more. Just always drawn to science. So looking back now as an adult, it makes sense why I wanted to become a nurse, because we do a lot of science in our jobs on a daily basis. I remember once I was in high school and I was able to take anatomy and physiology. That's a science class that teaches you about the human body and how everything functions together, all the different organs and cells and what they do. So I was just really fascinated by that. I'll start with my different jobs I've had as a nurse and then go backwards to the schooling that I did to get there. So my first position, I was super excited to land this position. My husband, at the time, he was working in Cleveland, so I moved down there with him when I was done with school. We were engaged to be married, and I was able to get my first nursing job at the Cleveland Clinic. That was like a dream of mine. The Cleveland Clinic is a world-renowned, famous hospital. They are amazing. There I worked on orthopedics and I learned so much being there. I'm so glad that was my first job, because I just continued to learn more and more. So orthopedics is a type of nursing job where patients have surgery or they're in being cared for because they have a problem with their bones, their joints. I worked there for 3 years before my husband and I were able to move back to Michigan. It was really sad to leave that job. I loved that job, but we wanted to be closer to family because we were both originally from Michigan. So once I was here in Michigan, I was able to land a job at Michigan Medicine or the University of Michigan Hospital. So currently, I've been there 10 years now. I am a float nurse for adult patients. So I float to 17 different adult units. So I love that I get to see every day that I go to work, it's something different. It's a different type of nursing because there's so many different types of nursing, but there's the bones like we talked about. There's general medicine. There's neurology that works with the brain and the spinal cord. There's a surgical short stay unit, so when people have surgery but they're able to still go home the same day or sometimes the next morning. So, and there's many more. I could go on and on, but those are some of the common ones that I go to, including, actually, I just think there's a floor for like liver patients, a floor for patients who have different kidney problems or kidney surgery. So I love that I get to float to all the different units and see different types of patients each day. It never gets boring, I can tell you that much. Just look at my notes here. So what a day-to-day looks like as a nurse for me. When you get into work, we get report from a nurse before us on patients that we're now going to take over, because a hospital, some people might not have thought about this, a hospital is open 24 hours a day. We can't send our patients home at night, so people work in the day and people work in the night. So when we're changing shifts, we have to fill in the next nurse taking over for those patients, what's been happening, what we're watching for. So that's something that we start our shift doing, and then we usually assess our patients, and some of you might have been in the hospital before or visited somebody in the hospital. So we have to listen to their heart and their lungs and check their pulses, check their vital signs like blood pressure. Has anybody had their blood pressure done before? Often we're counting how many times they're breathing per minute, just watching for any changes with the patient. We also give medications, lots of charting, all the assessments, stuff that I just listed that we do to assess our patients. We have to chart everything that we saw. If patients have wounds, cuts, surgery areas, infections, sometimes we're changing dressings, kind of like a big Band-Aid. Sometimes there might be a little gauze within that. We have to also chart that. And then we communicate with all of our patients. We have to make sure everybody's on the same team or same understanding with everything. And then we also communicate with our nurse aides. We communicate with the doctors, the physician's assistants. So we're kind of all like one big team taking care of these patients together. But the one thing that nurses are supposed to do, we are a patient advocate. So that means we are there for the patient. We're not there for the doctor. We're not there for the hospital. Our number one thing, we are there to speak up and advocate for that patient. So sometimes maybe they don't fully understand what's going on, so you help them to ask the right questions or explain to them what's going on. But you want to make sure that the patient is getting the best care that they can get and fully understanding what's going on. My three favorite things to do as a nurse are to educate my patients, because when you educate your patients, you're empowering them to know more about their body and to be able to help themselves. I love advocating or standing up for my patients. There's been a few times where I've had to stand firm if I believe that something isn't being done that should be done. And that's one thing I enjoy, speaking up for my patients and advocating for them. And then honestly, the other thing, I just love getting to talk with all of the different people from all over the world, really, especially at Cleveland Clinic. People came there from all over the world. At U of M, we get that some too. But still, even if they're local or in neighboring states, it's just interesting to see all the different types of people and have conversations with all of them. That really is my favorite part. Usually the days are very busy, but I wish I had more time to just get to know my patients. When I do have that time, I really enjoy that. And I think the patients do too. To become a nurse, I had to go to college. So first, I went to a community college and received my associate's degree in the science of nursing. Some people will refer to an associate's degree as a 2-year degree. That can be true for some degrees, but with nursing, it's not. It's still about a 4-year degree because you have prerequisites and then just the nursing clinical part alone, where you're learning in labs, in the hospital, nursing homes, community health centers. That is 2 years in itself. The one thing that I think you in your generation right now are going to have going for you, when I graduated, we won't talk about how many years ago from high school, I think I had 4 college credits. It wasn't as big of a thing. And I don't know if your teacher has talked with you about this, but when you get into high school, you can do some dual enrollment where you can take some classes through local colleges. And then you get college credits. So when you start college, you're a little bit ahead of the game. So I remember in nursing school, there was a girl who came in to school with 40 college credits already. And I was like, oh my gosh, that's amazing. I had 4. She was younger than me, so she went to a bigger school, so there were a little bit more opportunities for her. I was actually a medical assistant prior to becoming a nurse, which is also a great job. I worked in a doctor's office, a surgeon's office, as a medical assistant for 4 years. I was a receptionist for 2 years. I did my schooling while I was a receptionist there. Receptionist is like a front desk person, answers the phone, checks people in and out for their appointments. So then I did medical assisting, which I did a 2-year associate degree for that. That was just 2 years for the medical assistant. And then I had to take a test afterwards to become a certified medical assistant. So nursing is similar. Sorry, cats are rustling around over here. Nursing is similar. So I did the associate degree, and then I started my job at Cleveland Clinic, and then I slowly started doing my bachelor's degree, which was a 4-year degree. So at that point then, it was just about 2 years of classes, Mine took me a little longer because by that point I then had a child, so I was just doing one class at a time. So it probably took me 3 or 4, but that is one of the wonderful things about nursing that I love, is the flexibility that I was able to work full time, have a baby, and just take a class per semester and get it done. But once I originally got my associate degree, just to backtrack a little bit, you can't just become a nurse after going to college. You do have to take a test. It's called the NCLEX, and you have to pass that test. It's a state board exam. You have to pass that test because then we are licensed. We have our own license. Trying to think. So beyond your bachelor's degree, there are degrees beyond that, a master's degree or a doctorate degree. The most common careers people will do with those is a nurse practitioner, nursing educator, a CRNA, which is certified registered nurse anesthetist. So they work in surgery with doctors to put people to sleep for surgery. A midwife, they usually have a master's degree. I'm sure there's more I'm just not thinking of at the moment, but there are definitely other options. So to wrap up, I recommend anybody to become a nurse because there are so many different ways you can be a nurse. You can work in a hospital, you can work in a doctor's office, you can work in surgery, we just talked about. You can teach nursing at a college or a university. You could do clinicals, which is another way to teach a little bit more hands-on. There are health departments, community centers, insurance companies have jobs for nurses as well. There are legal nurses that work with lawyers in court also. And you know, the thing is too, nursing is a flexible position. There's so many different ways to get your hours. Currently, I'm contingent, which means I just have to work a couple days a month. So I'm able to be with the kids most of the time now, but if I want to work more, I can work more. So it's also flexible too as you get older, and if any of you have a family at some point, you're able to work around your family's schedule, which I find is one of the biggest perks. So I hope you all learned about nursing and enjoyed the presentation. If you have any questions, please let Mrs. Pfeiffer know, and I'm happy to answer any questions that I can.